Okay, so a huge transformation is happening in Alberta's healthcare system, and it's taking place somewhere you probably visit all the time, your local pharmacy. The role of the pharmacy team is changing in ways you might not even realize, so let's break down what's going on. This line from our source material really sets the stage, doesn't it? It points to this quiet revolution that's happening right under our noses, and it directly impacts how people in Alberta get their primary care. So, what exactly is going on behind that pharmacy counter? For a lot of us, when we think of a pharmacy, we picture someone counting pills and putting them in a bottle. That's the old view. But the new reality in Alberta? It's way more clinical. We're talking about a massive shift from just dispensing medications to actually assessing patients, diagnosing conditions, and even prescribing treatments. So, what does this new reality actually look like day to day? Let's dive into the expanded roles of the people working in our pharmacies. I mean, just look at how clinical these duties are. Pharmacists in Alberta are now on the front lines. They're basically acting as primary care providers, especially for patients who can't find a family doctor. They're assessing symptoms, diagnosing common problems, prescribing medications, and even helping manage chronic diseases. Some are even running their own walk-in clinics. It's a whole new ballgame. And it's not just the pharmacists. The role of pharmacy technicians has also grown a lot. They aren't just assisting anymore. They are absolutely essential to patient safety. We're talking about verifying prescriptions, counseling patients on how to use devices, managing really complex inventory. Their work is exactly what allows pharmacists to step up and handle those advanced clinical duties. This really shows you the potential here. According to the source, when you combine the clinical skills of the pharmacist with the critical operational role of the technician, you've got this incredibly powerful and accessible healthcare team. But, and this is a big but, the source also points out that this team is seriously underutilized. And that brings us to the core problem. With all these new responsibilities comes a totally new kind of risk. It's a problem our source material calls scope exposure. So here's the crucial point. It's one thing to expand what a professional is allowed to do, to expand their scope, but it's another thing entirely to build the systems that actually support and protect them while they're doing it. When you get one without the other, you end up with what's called scope exposure. It's basically just more risk without a safety net. So in the real world, this means you have pharmacists prescribing, but often without clear, standardized guidelines. You have technicians taking on way more complex tasks, but their role isn't always officially recognized by the regulations. The entire team is doing more, but without the clear guidance or liability protection they need for these new responsibilities. Okay, so that's the problem. And this situation has, understandably, prompted calls for a change. We're going to look at one proposed path forward that comes from a candidate for the Alberta College of Pharmacy Council who's trying to address these exact gaps. Our source for this is the platform of Ahmed Abdelfattah. And as you can see from his own words, he is living this new reality of pharmacy. He's a clinical pharmacist, he prescribes medicine, and he's even founded his own walk-in clinic. He also points to his really broad experience across pretty much every type of pharmacy out there. And he makes a specific point to say that in all of these jobs, he's worked right alongside pharmacy technicians, giving him a firsthand look at how much their contribution to patient care has grown. His platform really boils down to a three-part plan to close those gaps we just talked about. First, support pharmacists by creating the frameworks and standards they need to use their full scope safely. Second, advocate for technicians by making sure their official job description actually matches the vital work they're already doing. And third, make sure that any new policies reflect the reality that this is an integrated team. This quote right here really gets to the heart of his whole philosophy. The argument is simple. You can't just strengthen one part of the team and ignore the other. If you do that, you get an imbalanced, half-built system that can never work as well as it should and might even be unstable. So if you're not a pharmacist or a technician, why should any of this matter to you? Well, this final part of the platform connects all these professional issues directly back to the patient, to you. And at the end of the day, that's what this is all about. The argument is that building that full version of the system, one that supports both pharmacists and technicians, isn't just about making their jobs better. It's about patient safety. It's about the quality of care that every single Albertan gets. A well-supported, fully integrated pharmacy team can provide better, safer, and more accessible care for everyone. For the regulated members of the Alberta College of Pharmacy listening, these are the ideas that will be on the ballot.
Here are the key dates and details for the upcoming 2026 council election, where both pharmacists and pharmacy technicians will get to vote.
And for anyone who wants to dig a little deeper into this platform, the source provides this website for more information. And that brings us to one last really important thought. What's happening in Alberta's pharmacies is a perfect example of a much bigger question that healthcare systems everywhere are facing. As the jobs of our frontline professionals get bigger and more complex, the real challenge is this. How do we make sure the systems, the rules, and the protections that are supposed to support them evolve right along with them? It's a question that really affects us all.